Hello and welcome to Anticlock Academy. I am Dr. Krishan Mohan Kapoor, and in today's video, we'll be discussing arterial anatomy in the face and the key arteries that are crucial for injectable treatments. Understanding the facial arteries and their branches is essential for injectors as it helps in preventing complications such as vascular occlusion and ensures safe, effective treatment outcomes. The face is very rich in vascular structures, and knowing where the arteries are located and how they branch is key for performing facial injectable safely. Let's take a look at the most important arteries in the face and their relevance in injectables. The arteries in the face supply blood to the skin, muscles, and soft tissues of the face. The primary source of blood supply to the face is external carotid artery, which branches into various arteries that provide oxygenated blood to the different regions of the face. Some of these arteries are more superficial while others are located deeper. And as injectors, understanding their locations is crucial for avoiding vascular accidents such as necrosis or blindness. In this video, we'll be covering the facial artery and its main branches as well as other important arteries like the supraorbital, supratrochlear, infraorbital, and many more. Let's start with the facial artery, which is one of the most important vessels supplying the face. The facial artery originates from external carotid artery and it runs along the side of the face, supplying blood to the muscles of facial expressions, the skin, and various structures. The facial artery gives rise to several key branches that are important to know when performing injectable treatments. Facial artery gives labial branches. These are the branches which supply upper and lower lip. The proximity of these branches to the lip filler injections makes it crucial for injectors to understand their path to avoid hitting these vessels, as it could lead to bruising or vascular occlusion. Inferior labial artery, it supplies the lower lip and lower part of the chin area, whereas superior labial artery supplies the upper lip and also contributes to the supply of nose tip. Understanding these branches is important for filler treatments near the mouth and nose areas. The facial artery continues upwards towards the nasal side as angular artery after giving lateral nasal artery, which supplies the lower part of the nose. Next, we have the supraorbital and supratrochlear arteries, both of which are branches of ophthalmic artery, a branch of internal carotid artery. These arteries supply blood to the forehead and eye area. The supraorbital artery, it supplies the forehead, the scalp, and the eyebrow region. When performing treatment in the upper face, it is essential to know the location of supraorbital artery, as this is a high-risk area for vascular occlusion. The supratrochlear artery supplies medial forehead and also plays a role in eyebrow region. Understanding the path of supratrochlear artery is critical for safe injection into the forehead, especially while treating frown lines with fillers. Moving on to the infraorbital artery, this artery arises from the maxillary artery, a branch of external carotid artery. The infraorbital artery supplies blood to the lower eyelid, cheeks, and nasolabial folds. Understanding the path of infraorbital artery is critical when injecting the tear trough area or the midface, as it is located beneath the orbital rim. Care must be taken when performing dermal filler injections in these areas, as the proximity to the artery increases the risk of vascular compromise. In the lower face, we have mental and submental arteries. The mental artery is a branch of inferior alveolar artery and it supplies blood to the chin area and the lower lip area. Mental artery, which is located near the mental foramen, it provides blood to the chin and the lower part of the jawline. When performing chin augmentation or jawline contouring, knowing the position of mental artery is vital for avoiding vascular complication. The submental artery arises from the facial artery and it supplies the chin as well as the neck area in this region. The submental artery can be involved when performing neck rejuvenation or when doing chin filler injections with injectables. Understanding the path of artery allows injectors to navigate safely while treating the submental region. Superficial temporal artery and its branches. The superficial temporal artery is one of the terminal branches of external carotid artery. This artery runs upwards along the temples, providing blood to the scalp and the temple area. The location of the superficial temporal artery is critical when injecting the temple area. It is particularly important when performing temple volume restoration, as this artery is quite superficial and can be at risk for occlusion if injections are not placed carefully. Middle and deep temporal arteries. These arteries, they provide deeper blood supply to the temple area. Their path is very important for procedures such as temporal filling, where avoiding these arteries is essential to prevent complications. Lastly, we have transverse facial artery, which is a branch of superficial temporal artery and supplies blood to the cheeks. The transverse facial artery is significant for injectable treatments in the cheek area. The injectors need to be aware of its course to avoid inadvertent puncture during cheek filler procedure. Other smaller arteries also contribute to the blood supply of the face, and understanding their position and depth is equally important in maintaining safe injectable treatments. Understanding the facial arterial supply is crucial for performing safe, effective facial injectables. These arteries, they supply blood to the key areas of the face, and being aware of their paths allows us to avoid complications such as vascular occlusion and bruising. This knowledge helps us place injectables precisely, restore volume, and rejuvenate facial contours while minimizing the risk of complications. Thank you for watching today's video on facial arterial anatomy. I hope this discussion helps you better understand the vascular structures of the face and how they relate to injectable treatments. Stay tuned for more educational videos, and don't forget to like, comment and subscribe for further insights on facial anatomy and injectables.